CEN Test Prep Exam Book PDF. Question 1. A patient bitten by a rattlesnake develops severe pain, swelling, and ecchymosis at the site. The priority intervention is: Option A, application of ice to the bite. Option B, incising and suctioning the wound. Option C, application of a tourniquet. Option D, administration of antivenom, crotolide. The correct answer is option A. Application of ice to the bite. The definitive treatment for significant pit viper envenomation is antivenom. Outdated first aid measures can worsen tissue damage. In this rotation, A is the correct position. Question 2. The drug of choice for managing hypertension in a patient with a pheochromocytoma is: Option A, beta blockers alone. Option B, phenoxybenzamine, alpha blocker. Option C, ACE inhibitors. Option D, diuretics. The correct answer is option A. Beta blockers alone. Alpha blockade with phenoxybenzamine or phentolamine is the primary treatment. In this rotation, A is the correct position. Question 3. The most common initial symptom of multiple sclerosis is: Option A, seizures. Option B, optic neuritis, vision changes, eye pain. Option C, renal failure. Option D, cardiac dysrhythmia. The correct answer is option C, renal failure. Optic neuritis and sensory disturbances are common initial presentations of MS. In this rotation, C is the correct position. Question 4. A patient with cold, clammy skin, delayed capillary refill, and weak peripheral pulses is likely in which type of shock? Option A, distributive, early. Option B, cardiogenic or hypovolemic, compensated with vasoconstriction. Option C, neurogenic. Option D, anaphylactic. The correct answer is option D, anaphylactic. Cold, clammy skin with poor perfusion indicates compensatory vasoconstriction typical of cardiogenic or hypovolemic shock. In this rotation, D is the correct position. Question 5. The QSOFA score includes which three components? Option A, temperature, heart rate, WBC. Option B, altered mental status, respiratory rate greater than or equal to 22, systolic BP less than or equal to 100 mmHg. Option C, heart rate, respiratory rate, temperature. Option D, glucose, creatinine, lactate. The correct answer is option B, altered mental status, respiratory rate greater than or equal to 22, systolic BP less than or equal to 100 mmHg. QSOFA, Quick Sequential Organ Failure Assessment, uses altered mentation, tachypnea, and hypotension to screen for sepsis. Question 6. Which statement by a patient with a new diagnosis of epilepsy indicates a need for further teaching? Option A, I will take my medication every day as prescribed. Option B, I should get adequate sleep and avoid excess alcohol. Option C, I can stop my medication once the seizures stop. Option D, I will wear a medical alert bracelet. The correct answer is option C, I can stop my medication once the seizures stop. Anti-epileptic medications should never be abruptly discontinued. This requires further teaching. Question 7. The nurse is monitoring a patient post-cardiac catheterization. Which finding is most concerning? Option A, mild discomfort at the insertion site. Option B, expanding hematoma and loss of distal pulses. Option C, slight oozing from the puncture site. Option D, mild hypotension that responds to fluids. The correct answer is option D, mild hypotension that responds to fluids. Expanding hematoma with loss of pulses suggests arterial injury or hemorrhage requiring immediate intervention. In this rotation, D is the correct position. Question 8. The most common cause of autonomic dysreflexia is: Option A, pain. Option B, bladder distension. Option C, anxiety. Option D, fever. The correct answer is option B, bladder distension. Bladder distension, from blocked catheter, is the most common trigger for autonomic dysreflexia. Question 9. A patient receiving 4-heparin develops sudden flank pain and a drop in hemoglobin. The nurse suspects: Option A, myocardial infarction. Option B, retroperitoneal hemorrhage. Option C, pulmonary embolism. Option D, kidney stone. The correct answer is option C, pulmonary embolism. Anticoagulation with sudden flank pain and dropping hemoglobin suggests retroperitoneal bleeding, a life-threatening complication. In this rotation, C is the correct position. Question 10. A patient with hyperparathyroidism typically has which lab findings? Option A, low calcium and high phosphate. Option B, high calcium and low phosphate. Option C, low calcium and low phosphate. Option D, normal calcium and phosphate. The correct answer is option C, low calcium and low phosphate. Hyperparathyroidism causes hypercalcemia and hypophosphatemia. In this rotation, C is the correct position. Question 11. A patient with a kidney transplant presents with fever and graft tenderness. The nurse suspects: Option A, routine post-operative pain. Option B, urinary tract infection. Option C, acute rejection. Option D, muscle strain. The correct answer is option A, routine post-operative pain. Fever and graft tenderness in a transplant patient suggest acute rejection. In this rotation, A is the correct position. Question 12. A patient with a chest tube to water seal has continuous bubbling in the water seal chamber. This indicates: Option A, normal chest tube function. Option B, a persistent air leak in the system or patient's lung. Option C, the lung has fully re-expanded. Option D, the suction is too high. The correct answer is option D, the suction is too high. Continuous bubbling in the water seal chamber indicates an air leak. Intermittent bubbling during exhalation or coughing is normal. In this rotation, D is the correct position. Question 13. The nurse notes pacemaker spikes without following QRS complexes. This is called: Option A, failure to capture. Option B, failure to sense. Option C, oversensing. Option D, undersensing. The correct answer is option A, failure to capture. Failure to capture occurs when a pacing spike is not followed by depolarization. Question 14. A patient with adrenal crisis presents with: Option A, hypertension and hyperglycemia. Option B, hypotension, hyponatremia, hyperkalemia, and hypoglycemia. Option C, hypocalcemia and hypophosphatemia. Option D, polyuria and polydipsia. The correct answer is option B, hypotension, hyponatremia, hyperkalemia, and hypoglycemia. Adrenal crisis causes mineralocorticoid and glucocorticoid deficiency, hypotension, hyponatremia, hyperkalemia, and hypoglycemia. Question 15. The nurse is caring for a patient who is a victim of domestic violence. The priority intervention is: Option A, contact the abuser for their side of the story. Option B, assess and treat injuries, ensure patient safety, and provide resources. Option C. Discharge the patient immediately. Option D. Advise the patient to go home and work it out. The correct answer is option A. Contact the abuser for their side of the story. Patient safety is the priority. Injuries are treated, safety assessed, and referrals provided. In this rotation, A is the correct position. Question 16. A patient having a tonic-clonic seizure requires which priority intervention? Option A. Restrain the patient firmly. Option B. Insert a bite block between the teeth. Option C. Maintain airway, administer benzodiazepines as ordered. Option D. Obtain a stat CT scan before treatment. The correct answer is option C. Maintain airway, administer benzodiazepines as ordered. The priorities during an active seizure are airway management, oxygenation, and pharmacological termination with benzodiazepines. Question 17. A patient with a cholinergic crisis from excess pyridostigmine presents with Option A. Dry mouth and tachycardia. Option B. Excessive salivation, lacrimation, diarrhea, and muscle fasciculations. Option C. Muscle rigidity. Option D. Hypertension. The correct answer is option D. Hypertension. Cholinergic crisis causes sludge symptoms from excess acetylcholine. In this rotation, D is the correct position. Question 18. The most appropriate initial antibiotic for community-acquired pneumonia in a previously healthy adult is Option A. Vancomycin. Option B. Azithromycin or doxycycline. Option C. Ciprofloxacin. Option D. Clindamycin. The correct answer is option C. Ciprofloxacin. Macrolides or doxycycline are first line for uncomplicated CAP. In this rotation, C is the correct position. Question 19. A patient with a transfusion-related acute lung injury, TRLI, presents with Option A. Fever and rash. Option B. Acute dyspnea, hypoxemia, and bilateral pulmonary edema within 6 hours of transfusion. Option C. Hypertension. Option D. Anaphylaxis. The correct answer is option A. Fever and rash. TRLI is characterized by acute respiratory distress and non-cardiogenic pulmonary edema after transfusion. In this rotation, A is the correct position. Question 20. A patient with hypoglycemia who is conscious and able to swallow should be treated with Option A. 4-dextrose 50%. Option B. Glucagon IM. Option C. Oral fast-acting carbohydrates, juice, glucose tablets. Option D. Insulin. The correct answer is option C. Oral fast-acting carbohydrates, juice, glucose tablets. Conscious patients with intact swallow can be treated with oral fast-acting carbohydrates. Question 21. A patient's ECG shows a wide QRS with a capture beat and fusion beat. This is consistent with Option A. Ventricular tachycardia. Option B. SVT with aberrancy. Option C. Atrial fibrillation with WPW. Option D. Sinus tachycardia with BBB. The correct answer is option D. Sinus tachycardia with BBB. Capture and fusion beats are pathognomonic for VT. In this rotation, D is the correct position. Question 22. A patient with a small bowel obstruction has nasogastric tube placement. The primary purpose is Option A. Nutritional support. Option B. Administration of medications. Option C. Decompression of the stomach to relieve vomiting and distension. Option D. Diagnostic testing only. The correct answer is option A. Nutritional support. NG tube decompresses the stomach, relieving vomiting and reducing the risk of aspiration. In this rotation, A is the correct position. Question 23. A patient in shock has a central venous pressure, CVP, of 2 mmHg. This indicates option A volume overload, option B low preload, hypovolemia, option C normal preload, option D right ventricular failure. The correct answer is option D, right ventricular failure. Normal CVP is 2 to 8 mmHg. Very low CVP indicates hypovolemia. In this rotation, D is the correct position. Question 24. A patient with COPD has the following ABG on 2LO2, pH 7.32, PaCO2 65, PaO2 58, HCO 330. This ABG indicates option A acute respiratory acidosis, option B acute on chronic respiratory acidosis, option C metabolic acidosis, option D metabolic alkalosis. The correct answer is option B, acute on chronic respiratory acidosis. The low pH, elevated PaCO2, and elevated HCO3 compensation indicate acute on chronic respiratory acidosis, typical in COPD exacerbation. Question 25. Which medication is a priority intervention for acute pulmonary edema with a BP of 180/100 mmHg? Option A dopamine infusion, option B 4-furosemide and nitroglycerin, option C oral metoprolol, option D 4 normal saline bolus. The correct answer is option C, oral metoprolol. Aggressive afterload reduction and diuresis are priorities. In this rotation, C is the correct position. Question 26. A patient with a traumatic brain injury develops diabetes insipidus. The nurse would expect option A decreased urine output and concentrated urine, option B polyuria with dilute urine and hypernatremia, option C oliguria and hypotension, option D hematuria and flank pain. The correct answer is option B, polyuria with dilute urine and hypernatremia. Diabetes insipidus causes massive diuresis of dilute urine, leading to hypernatremia and hypovolemia. Question 27. A patient on a ventilator has a sudden drop in EtCO2 from 35 to 5 mmHg. The nurse suspects option A increased cardiac output, option B esophageal intubation or circuit disconnection, option C fever, option D improved ventilation. The correct answer is option D, improved ventilation. A sudden drop in EtCO2 to near zero suggests extubation, esophageal intubation, or complete circuit disconnect. In this rotation, D is the correct position. Question 28. The coronary artery most commonly affected in acute MI is option A, right coronary artery, option B left anterior descending artery, option C left circumflex artery, option D left main coronary artery. The correct answer is option C, left circumflex artery. The lat is the most commonly occluded vessel. In this rotation, C is the correct position. Question 29. A potential adverse effect specific to formoterone includes option A hypotension and bradycardia, option B pulmonary fibrosis, option C hepatotoxicity, option D corneal deposits. The correct answer is option A, hypotension and bradycardia. Acute foramidoron most commonly causes hypotension and bradycardia. Question 30. A patient with Parkinson's disease is at risk for which complication in the emergency department? Option A, hypertension. Option B, aspiration pneumonia. Option C, hyperglycemia. Option D, deep vein thrombosis only. The correct answer is option D, deep vein thrombosis only. Dysphagia in Parkinson's increases aspiration risk. Aspiration pneumonia is a common cause of ED visits and death. In this rotation, D is the correct position. Question 31. Which finding on end-tidal CO2 monitoring indicates successful endotracheal intubation? Option A, EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, EtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent waveform confirms tracheal placement. Question 32. A patient develops acute respiratory distress, hypoxemia, and bilateral pulmonary infiltrates 24 hours after major trauma. The nurse suspects. Option A, pneumonia. Option B, pulmonary embolism. Option C, acute respiratory distress syndrome, ARDS. Option D, heart failure. The correct answer is option D, heart failure. ARDS can develop after trauma due to systemic inflammation, causing non-cardiogenic pulmonary edema. In this rotation, D is the correct position. Question 33. A patient presents with fever, productive cough, and a chest X-ray showing consolidation of the right lower lobe. The most likely diagnosis is Option A, acute bronchitis. Option B, pulmonary embolism. Option C, lobar pneumonia. Option D, pleural effusion. The correct answer is option D, pleural effusion. Fever, productive cough, and lobar consolidation on CXR are classic for lobar pneumonia. In this rotation, D is the correct position. Question 34. Which of the following is a common cause of a subdural hematoma? Option A, laceration of the middle meningeal artery. Option B, tearing of bridging veins between the dura and brain surface. Option C, rupture of a cerebral aneurysm. Option D, fracture of the temporal bone. The correct answer is option C, rupture of a cerebral aneurysm. Subdural hematomas are usually caused by tearing of bridging veins. In this rotation, C is the correct position. Question 35. The Parkland formula for fluid resuscitation in burns is Option A, 2 ml x/kg x% TBSA of lactated ringers, half in first 8 hours. Option B, 4 ml x/kg x% TBSA of normal saline. Option C, 1 ml x/kg x% TBSA of D5W. Option D, 3 ml x/kg x% TBSA of colloid. The correct answer is option A, 2 ml x/kg x% TBSA of lactated ringers, half in first 8 hours. Parkland formula, 4 ml x weight, kg, x% TBSA burned. Half is given in the first 8 hours from time of burn. Question 36. Which of the following is a normal urine output for an adult? Option A, 0.5 ml/kg/hr or less. Option B, 0.5 to 1 ml/kg/hr or more. Option C, less than 100 ml per day. Option D, more than 5 liters per day. The correct answer is option B, 0.5 to 1 ml/kg/hr or more. Normal urine output is at least 0.5 to 1 ml/kg/hr. Oliguria is less than 0.5 ml/kg/hr. Question 37. A patient with an acute MI develops a new hollow systolic murmur at the apex radiating to the axilla. The nurse suspects which complication? Option A, ventricular septal rupture. Option B, papillary muscle rupture with acute mitral regurgitation. Option C, pericarditis with friction rub. Option D, aortic dissection. The correct answer is option B. Papillary muscle rupture with acute mitral regurgitation. A hollow systolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture. Question 38. A patient with a spontaneous pneumothorax who is stable and has a small, 2 cm, pneumothorax may be managed with Option A, needle decompression. Option B, observation and supplemental oxygen. Option C, chest tube insertion. Option D, thoracotomy. The correct answer is option A. Needle decompression. Small, primary spontaneous pneumothoraces in stable patients can be managed conservatively with observation and oxygen. In this rotation, A is the correct position. Question 39. A patient with a penetrating eye injury should be positioned. Option A, flat with the affected eye down. Option B, with the head of bed elevated and both eyes patched if ordered. Option C, lying on the affected side. Option D, in Trendelenburg. The correct answer is option C, lying on the affected side. Head elevation reduces intraocular pressure. Both eyes may be patched to reduce eye movement. In this rotation, C is the correct position. Question 40. A patient with acute asthma exacerbation has a peak expiratory flow rate of 30% of predicted. The nurse classifies this as Option A, mild exacerbation. Option B, severe or life-threatening exacerbation. Option C, moderate exacerbation. Option D, well-controlled asthma. The correct answer is option B, severe or life-threatening exacerbation. PEFR less than 40% of predicted indicates a severe exacerbation. Less than 25% is life-threatening. Question 41. The nurse is caring for a patient post-ictal after a seizure. The patient is confused but has a patent airway. The nurse should Option A, restrain the patient. Option B, place the patient in a side-lying position and allow to rest. Option C, administer more anticonvulsants immediately. Option D, insert an oral airway. The correct answer is option B. Place the patient in a side-lying position and allow to rest. Post-ictal patients need airway protection, side-lying, and a safe environment. They should not be restrained. Question 42. Which intervention is most important in the immediate management of suspected acute aortic dissection? Option A, administer thrombolytics. Option B, aggressive BP control with beta blockers. Option C, immediate cardioversion. Option D, high-dose diuretics. The correct answer is option C, immediate cardioversion. Immediate BP control with beta blockers reduces aortic wall stress. In this rotation, C is the correct position. Question 43. A patient presents with an acute stroke 90 minutes after symptom onset. Blood pressure is 190/110 mmHg. The plan is to administer TPA. The nurse should Option A, lower BP aggressively to 120/80 before TPA. Option B, lower BP to below 185/110 before and maintain below 180/105 after TPA. Option C, ignore the blood pressure. Option D, cancel TPA and manage BP only. The correct answer is option C. Ignore the blood pressure. BP must be below 185/110 to safely administer TPA. Labetalol or nicardipine is typically used. In this rotation, C is the correct position. Question 44. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with Option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option C, irritable bowel syndrome. The classic presentation of small bowel obstruction includes cramping pain, distension, vomiting, and early high-pitched bowel sounds. In this rotation, C is the correct position. Question 45. The most common causative organism in urinary tract infections is Option A, Staphylococcus aureus. Option B, Pseudomonas aeruginosa. Option C, Escherichia coli. Option D, Enterococcus faecalis. The correct answer is option D, Enterococcus faecalis. E. coli accounts for the vast majority of uncomplicated UTIs. In this rotation, D is the correct position. Question 46. A patient with tumor lysis syndrome has which characteristic lab abnormalities? Option A, hypokalemia, hypophosphatemia, hypocalcemia. Option B, hyperkalemia, hyperphosphatemia, hypocalcemia, hyperuricemia. Option C, hypernatremia, hypercalcemia. Option D, hypokalemia, hypercalcemia. The correct answer is option A, hypokalemia, hypophosphatemia, hypocalcemia. TLS causes release of intracellular contents, hyperkalemia, hyperphosphatemia, hypocalcemia, due to calcium phosphate precipitation, and hyperuricemia. In this rotation, A is the correct position. Question 47. Which medication is used to reverse the effects of benzodiazepines in overdose? Option A, naloxone. Option B, flumazenol. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option D, atropine. Flumazenol is a benzodiazepine antagonist. However, its use is controversial due to seizure risk. In this rotation, D is the correct position. Question 48. A patient with myasthenia gravis presents with ptosis, diplopia, and progressive weakness. These symptoms are due to Option A, demyelination of central nerves. Option B, destruction of dopamine-producing neurons. Option C, antibodies against acetylcholine receptors at the neuromuscular junction. Option D, compression of the spinal cord. The correct answer is option C, antibodies against acetylcholine receptors at the neuromuscular junction. MG is an autoimmune disorder where antibodies block or destroy acetylcholine receptors, impairing neuromuscular transmission. Question 49. A patient with severe flank pain has a positive urine pregnancy test. The nurse's next priority is Option A, administer pain medication and obtain renal imaging. Option B, discharge with follow-up. Option C, rule out ectopic pregnancy with ultrasound. Option D, administer antibiotics. The correct answer is option B, discharge with follow-up. Ectopic pregnancy must be ruled out first in a pregnant patient with pain. even if symptoms suggest renal colic. In this rotation, B is the correct position. Question 50. A patient with a history of bariatric surgery presents with abdominal pain, tachycardia, and fever. The nurse suspects Option A, dumping syndrome. Option B, anastomotic leak. Option C, constipation. Option D, gallstones. The correct answer is option D, gallstones. Tachycardia, fever, and abdominal pain after bariatric surgery suggest anastomotic leak, a surgical emergency. In this rotation, D is the correct position. Question 51. The treatment for severe hypermagnesemia includes Option A, magnesium supplements. Option B, 4-calcium gluconate and supportive care. Option C, oral phosphate binders. Option D, thiazide diuretics. The correct answer is option A, magnesium supplements. 4-calcium antagonizes the effects of magnesium. Hemodialysis may be needed for severe cases. In this rotation, A is the correct position. Question 52. Which physical finding is most consistent with a patient who has a significant pleural effusion? Option A, hyperresonance to percussion. Option B, increased tactile fremitus. Option C, dullness to percussion and decreased breath sounds. Option D, tracheal deviation away from the affected side. The correct answer is option A, hyperresonance to percussion. Pleural effusion causes dullness to percussion, decreased breath sounds, and decreased fremitus. In this rotation, A is the correct position. Question 53. The nurse is teaching a patient about migraine triggers. Which of the following should be avoided? Option A, regular sleep schedule. Option B, adequate hydration. Option C, aged cheeses, red wine, and chocolate. Option D, regular meals. The correct answer is option D, regular meals. Tyramine-containing foods, aged cheese, red wine, and chocolate are common migraine triggers. In this rotation, D is the correct position. Question 54. Which laxative is used to reduce serum ammonia levels in hepatic encephalopathy? Option A, bisacodyl. Option B, docusate sodium. Option C, lactulose. Option D, psyllium. The correct answer is option B, docusate sodium. Lactulose reduces ammonia by acidifying the colon and promoting ammonia excretion. In this rotation, B is the correct position. Question 55. A patient with a history of asthma presents with severe dyspnea and a silent chest on auscultation. This finding indicates Option A, the asthma attack has resolved. Option B, severe airway obstruction with minimal air movement. Option C, pneumonia. Option D, pulmonary embolism. The correct answer is option B, severe airway obstruction with minimal air movement. A silent chest in an asthmatic is an ominous sign indicating such severe obstruction that no wheezing is audible. Question 56. The most common cause of acute renal failure in hospitalized patients is Option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. ADN is the most common cause of intrinsic acute kidney injury, often due to prolonged hypotension or nephrotoxic agents. Question 57. The drug of choice for rate control in stable AF with RVR without heart failure is Option A, adenosine. Option B, diltiazem or metoprolol. Option C, amiodarone. Option D, procainamide. The correct answer is option C, amiodarone. Beta blockers or calcium channel blockers are first line. In this rotation, C is the correct position. Question 58. A patient with testicular torsion will have which characteristic finding? Option A, horizontal lie of the testicle and absent cremasteric reflex. Option B, normal testicular position. Option C, gradual onset of pain over days. Option D, relief of pain with elevation of the scrotum. The correct answer is option B, normal testicular position. Torsion presents with a high riding, horizontal testicle and absent cremasteric reflex. In this rotation, B is the correct position. Question 59. A patient with preeclampsia has which classic triad? Option A, hypotension, bradycardia, hypothermia. Option B, hypertension, proteinuria, edema. Option C, fever, cough, rhinorrhea. Option D, chest pain, diaphoresis, dyspnea. The correct answer is option D, chest pain, diaphoresis, dyspnea. The classic triad of preeclampsia is hypertension, proteinuria, and edema. In this rotation, D is the correct position. Question 60. The most common cause of distributive shock is: Option A, anaphylaxis. Option B, neurogenic injury. Option C, sepsis. Option D, adrenal crisis. The correct answer is option D, adrenal crisis. Sepsis is by far the most common cause of distributive shock. In this rotation, D is the correct position. Question 61. A patient with a BP of 80/50 and HR of 130 is in which stage of shock? Option A, decompensated shock. Option B, compensated shock. Option C, irreversible shock. Option D, neurogenic shock. The correct answer is option A, decompensated shock. Hypotension with tachycardia indicates decompensated shock where compensatory mechanisms are failing. Question 62. Which type of shock is characterized by decreased cardiac output, elevated SVR, and jugular venous distension? Option A, cardiogenic shock. Option B, hypovolemic shock. Option C, distributive shock. Option D, neurogenic shock. The correct answer is option A, cardiogenic shock. In cardiogenic shock, the pump fails, causing decreased CO, compensatory vasoconstriction, high SVR, and backup of preload, JVD. Question 63. A patient with organophosphate poisoning should receive which medications? Option A, atropine and pralidoxime, 2-PAM. Option B, naloxone and flumazenol. Option C, sodium bicarbonate and calcium. Option D, N-acetylcysteine. The correct answer is option A, atropine and pralidoxime, 2-PAM. Atropine blocks muscarinic effects, pralidoxime regenerates acetylcholinesterase. Question 64. The nurse administers a fluid bolus to a patient in shock. The CVP rises from 2 to 12 mmHg with little change in blood pressure. This indicates: Option A, the patient needs more fluids. Option B, the patient is fluid responsive. Option C, poor cardiac function, fluid is not being pumped effectively. Option D, normal response. The correct answer is option A, the patient needs more fluids. A significant rise in CVP without improvement in BP suggests the heart cannot handle the volume, indicating pump failure. In this rotation, A is the correct position. Question 65. The safe harbor provision for nurses typically refers to: Option A law that provides legal immunity in all circumstances. Option B, a process where a nurse can request peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C, a hospital policy allowing nurses to refuse any assignment. Option D, the requirement to report all medication errors. The correct answer is option D, the requirement to report all medication errors. Safe harbor laws allow nurses to accept an assignment but invoke review, providing some protection from retaliation. In this rotation, D is the correct position. Question 66. Which potassium level is most concerning and requires immediate intervention? Option A 3.5 milliequivalent/L. Option B 6.8 milliequivalent/L with ECG changes. Option C 4.0 milliequivalent/L. Option D 5.0 milliequivalent/L. The correct answer is option A, 3.5 milliequivalent/L. Severe hyperkalemia with ECG changes is a life-threatening emergency requiring immediate treatment. In this rotation, A is the correct position. Question 67. A patient with hemorrhagic shock is receiving a massive transfusion. The target ratio for transfusion is approximately: Option A 1:1:1, PRBCs FFP platelets. Option B 2:1:1. Option C 3:1:0. Option D 1:2:1. The correct answer is option D, 1:2:1. Damage control resuscitation uses approximately equal ratios of packed RBCs, fresh frozen plasma, and platelets. In this rotation, D is the correct position. Question 68. The antidote for digoxin toxicity is: Option A naloxone. Option B flumazenol. Option C digoxin immune fab, Digibind. Option D calcium gluconate. The correct answer is option A, naloxone. Digoxin-specific antibody fragments bind free digoxin and reverse toxicity. In this rotation, A is the correct position. Question 69. A patient with a severe headache and nuchal rigidity has a CT scan that is negative for blood. The next step is: Option A discharge the patient home. Option B administer pain medication only. Option C perform a lumbar puncture to rule out subarachnoid hemorrhage. Option D order an MRI. The correct answer is option D, order an MRI. CT may miss small SAH. Lumbar puncture is necessary to detect xanthochromia if clinical suspicion remains high. In this rotation, D is the correct position. Question 70. The primary treatment for DIC is: Option A massive transfusion protocol regardless of bleeding. Option B treating the underlying cause and supportive care with blood products. Option C anticoagulation only. Option D fibrinolytics. The correct answer is option C, anticoagulation only. The cornerstone of DIC management is treating the underlying condition. Supportive blood products are given for active bleeding. In this rotation, C is the correct position. Question 71. A patient with anaphylaxis develops respiratory distress, wheezing, and hypotension. The priority medication is: Option A albuterol nebulizer. Option B 4-diphenhydramine. Option C 4 corticosteroids. Option D intramuscular epinephrine. The correct answer is option B, 4-diphenhydramine. Epinephrine is the first-line treatment for anaphylaxis. IM administration into the anterolateral thigh is the preferred route. In this rotation, B is the correct position. Question 72. A patient is being discharged after treatment for pneumonia. The nurse includes which important discharge instruction? Option A. Stop antibiotics when you feel better. Option B. Return to work immediately. Option C. Complete all prescribed antibiotics and follow up with your provider. Option D. Restrict all fluids for the next week. The correct answer is option C. Complete all prescribed antibiotics and follow up with your provider. Completing the full course of antibiotics and ensuring follow-up are essential to prevent recurrence and complications. Question 73. A patient in the ED suddenly develops pulseless ventricular tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. Synchronized cardioversion at 100 J. Option C. Immediate high-quality CPR and defibrillation. Option D. Transcutaneous pacing. The correct answer is option D. Transcutaneous pacing. Pulseless VT is a shockable rhythm treated with immediate CPR and defibrillation. In this rotation, D is the correct position. Question 74. A patient with a subarachnoid hemorrhage is at highest risk for vasospasm during which time period? Option A. First 24 hours. Option B. Days 4 to 14 after hemorrhage. Option C. After 1 month. Option D. First hour only. The correct answer is option B. Days 4 to 14 after hemorrhage. Cerebral vasospasm typically occurs between days 4 and 14 after SAH, causing delayed cerebral ischemia. Question 75. The most common cause of right-sided heart failure is? Option A. Right ventricular MI. Option B. Left-sided heart failure. Option C. Pulmonary embolism. Option D. Tricuspid valve stenosis. The correct answer is option B. Left-sided heart failure. Left-sided heart failure is the most common cause of right-sided heart failure. Question 76. A patient presents to the ED with a laceration requiring sutures. During the procedure, the patient states they feel faint. The nurse's first action is: Option A. Administer oxygen. Option B. Place the patient in Trendelenburg position. Option C. Immediately discontinue the procedure. Option D. Assess vital signs. The correct answer is option C. Immediately discontinue the procedure. The procedure should be stopped immediately to reduce vagal stimulation and prevent syncope. Then the patient can be placed supine and assessed. Question 77. A patient with hyperosmolar hyperglycemic state, HHS, differs from DKA in that HHS. Option A has significant ketosis. Option B has extreme hyperglycemia and hyperosmolality without significant ketosis. Option C has lower blood glucose levels. Option D occurs only in type 1 diabetes. The correct answer is option A. Has significant ketosis. HHS features extreme hyperglycemia and dehydration without significant ketosis. In this rotation, A is the correct position. Question 78. The nurse is assessing a patient with a suspected basilar skull fracture. Which finding requires immediate notification? Option A. Scalp laceration. Option B. Clear nasal drainage testing positive for glucose. Option C. Headache. Option D. Nausea. The correct answer is option D. Nausea. Glucose positive clear nasal drainage indicates CSF leak. requiring neurosurgical evaluation. In this rotation, D is the correct position. Question 79. A patient's central venous pressure is 18 mmHg with clear lung sounds and hypotension. This suggests Option A, left ventricular failure. Option B, right ventricular infarction. Option C, cardiac tamponade. Option D, hypovolemia. The correct answer is option C, cardiac tamponade. Elevated CVP with hypotension and clear lungs suggests RV infarction or tamponade. In this rotation, C is the correct position. Question 80. The most effective method to prevent hypothermia in a trauma patient is Option A, warmed blankets only. Option B, warmed for fluids, external warming devices, and maintaining a warm environment. Option C, cold for fluids. Option D, room temperature environment. The correct answer is option C, cold for fluids. A combination of warmed fluids, external warming, and warm environment prevents the lethal triad. In this rotation, C is the correct position. Question 81. A patient with a psychiatric emergency has homicidal ideation. The nurse's priority is Option A, allow the patient to leave if they want. Option B, ensure safety of the patient, staff, and others, initiate psychiatric hold protocols. Option C, administer medications without consent. Option D, ignore the statements. The correct answer is option B, ensure safety of the patient, staff, and others, initiate psychiatric hold protocols. Homicidal ideation requires immediate safety measures, including possible involuntary hold. Question 82. A patient with a tracheostomy tube has copious thick secretions. The priority nursing intervention is Option A, increase sedation. Option B, frequent suctioning and humidification of inspired air. Option C, remove the tracheostomy tube. Option D, administer antitussives. The correct answer is option B, frequent suctioning and humidification of inspired air. Adequate humidification and suctioning maintain airway patency and prevent mucus plugging. Question 83. ST elevation in V1 V2 with a saddleback pattern is characteristic of Option A, Brugada syndrome. Option B, STEMI. Option C, pericarditis. Option D, left bundle branch block. The correct answer is option A, Brugada syndrome. Brugada syndrome is characterized by ST elevation in V1 V2 with a saddleback or coved pattern. Question 84. A patient receiving magnesium sulfate develops respiratory depression and absent patellar reflexes. The nurse should Option A, continue the infusion and monitor. Option B, stop the infusion and administer calcium gluconate. Option C, increase the infusion rate. Option D, administer naloxone. The correct answer is option B, stop the infusion and administer calcium gluconate. Loss of reflexes and respiratory depression indicate magnesium toxicity. Calcium gluconate is the antidote. Question 85. A patient with diabetic ketoacidosis has a potassium of 5.5 milliequivalent/L on admission. The nurse understands this is due to Option A, total body potassium excess. Option B, shift of potassium out of cells due to acidosis. Option C, renal failure. Option D, excess potassium intake. The correct answer is option C, renal failure. Acidosis shifts potassium extracellularly, masking total body potassium depletion. Levels drop with insulin and fluid therapy. In this rotation, C is the correct position. Question 86. The nurse is assessing a patient for aortic dissection. Which physical finding is most specific? Option A, chest pain. Option B, blood pressure differential of greater than 20 mmHg between arms. Option C, tachycardia. Option D, dyspnea. The correct answer is option C, tachycardia. A significant BP difference between arms suggests aortic dissection involving the subclavian artery. In this rotation, C is the correct position. Question 87. The initial treatment for a patient with an acute hemolytic transfusion reaction is: Option A, slowing the transfusion rate. Option B, stopping the transfusion, aggressive for fluids, and diuretics to maintain urine output. Option C, administering antihistamines. Option D, continuing the transfusion at a slower rate. The correct answer is option A, slowing the transfusion rate. Immediate cessation of the transfusion, fluid resuscitation, and maintaining urine output to prevent renal failure are critical. In this rotation, A is the correct position. Question 88. A patient who is a Jehovah's Witness refuses blood transfusion despite life-threatening hemorrhage. The nurse should: Option A, administer the transfusion anyway to save the patient's life. Option B, respect the patient's autonomous decision and continue alternative treatments. Option C, obtain a court order immediately. Option D, administer blood without telling the patient. The correct answer is option B, respect the patient's autonomous decision and continue alternative treatments. A competent adult has the right to refuse any treatment, even life-saving measures. The decision must be respected. Question 89. A patient presents with acute dyspnea, unilateral pleuritic chest pain, and a low-grade fever 2 weeks after a hip replacement. The most likely diagnosis is: Option A, pneumonia. Option B, pulmonary embolism. Option C, myocardial infarction. Option D, atelectasis. The correct answer is option B, pulmonary embolism. Post-operative immobility, orthopedic surgery, and the presentation strongly suggest pulmonary embolism. Question 90. The definitive treatment for acute cholecystitis is: Option A, antibiotics alone. Option B, observation only. Option C, cholecystectomy. Option D, endoscopic sphincterotomy. The correct answer is option D, endoscopic sphincterotomy. Cholecystectomy is the definitive treatment for acute cholecystitis. In this rotation, D is the correct position. Question 91. A patient presents with SLUDGEM symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, and meiosis. This toxidrome is caused by: Option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option D, opioids. The SLUDGEM presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. In this rotation, D is the correct position. Question 92. The priority patient for a trauma team activation based on mechanism of injury is: Option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option A, an adult who fell from standing height. Ejection from a motor vehicle is a high-risk mechanism warranting trauma team activation. In this rotation, A is the correct position. Question 93. A patient with acute liver failure develops cerebral edema. The nurse should anticipate administering option A hypertonic saline or mannitol, option B hypotonic fluids, option C high-dose corticosteroids, option D antibiotics only. The correct answer is option C, high-dose corticosteroids. Mannitol or hypertonic saline is used to reduce cerebral edema in acute liver failure. In this rotation, C is the correct position. Question 94. Which of the following patients is at highest risk for developing DKA? Option A type 2 diabetic with good control. Option B, A type 1 diabetic with an infection who missed insulin doses. Option C, a non-diabetic patient. Option D, a patient with well-managed diabetes. The correct answer is option D, a patient with well-managed diabetes. Type 1 diabetics who miss insulin and have an infection are at highest risk for DKA. In this rotation, D is the correct position. Question 95. The most common cause of hemoptysis in the emergency department is option A pulmonary embolism, option B bronchitis, option C lung cancer, option D tuberculosis. The correct answer is option A, pulmonary embolism. Acute bronchitis is the most common cause of hemoptysis in the ED setting. In this rotation, A is the correct position. Question 96. A patient with anticholinergic toxicity presents with option A salivation, lacrimation, urination. Option B dry skin, flushed appearance, mydriasis, tachycardia, and altered mental status. Option C pinpoint pupils and respiratory depression. Option D muscle rigidity and hyperreflexia. The correct answer is option A, salivation, lacrimation, urination. Anticholinergic toxidrome, hot as a hare, blind as a bat, dry as a bone, red as a beet, mad as a hatter. In this rotation, A is the correct position. Question 97. A patient with cardiac tamponade will have which echocardiographic finding? Option A left ventricular hypertrophy. Option B, right ventricular diastolic collapse. Option C aortic stenosis. Option D mitral valve prolapse. The correct answer is option D, mitral valve prolapse. RV diastolic collapse is a specific sign of tamponade. In this rotation, D is the correct position. Question 98. A patient with acute respiratory distress has the following ABG, pH 7.22, PaCO2 58, PaO2 62, HCO 324. This represents option A uncompensated respiratory acidosis, option B compensated respiratory acidosis, option C uncompensated metabolic acidosis, option D compensated metabolic acidosis. The correct answer is option B, compensated respiratory acidosis. Low pH with elevated PaCO2 and normal HCO3 indicates acute, uncompensated respiratory acidosis. In this rotation, B is the correct position. Question 99. The most common cause of airway obstruction in an unconscious patient is option A laryngospasm, option B foreign body aspiration, option C the tongue, option D mucosal edema. The correct answer is option D, mucosal edema. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly. In this rotation, D is the correct position. Question 100. Which of the following is a classic finding in diabetic ketoacidosis, DKA? Option A, hypoglycemia and metabolic alkalosis. Option B, hyperglycemia, anion gap metabolic acidosis, and ketonuria. Option C, hyperglycemia without ketones. Option D, hypoglycemia with ketones. The correct answer is option B. Hyperglycemia, anion gap metabolic acidosis, and ketonuria. DKA is characterized by hyperglycemia, ketosis, and high anion gap metabolic acidosis.